One simple tip can save the life of your newborn. As we know that during pregnancy, the baby is attached with the mother through umbilical cord that delivers nutrients and oxygen to the baby and removes baby's waste products. But when the umbilical cord is cut, it is an entry point for bacteria that can cause newborn sepsis and death. Bacteria rapidly colonize the moist cord stump and have a direct access to the bloodstream through umbilical vessels that remain patent for the first few days after birth. Each year, 3 million newborns die globally, and infection causes approximately 13% of these deaths. Poor hygiene and antisepsis at birth and in the first week of life increases the risk of deadly but preventable infections. So, to reduce the neonatal mortality, WHO introduced a simple magical medicine that is chlorhexidine. 7.1% chlorhexidine digluconate was added to 2013 in the list of essential medicines for children, especially for the umbilical cord care. This one simple medicine can save your child from infection and hence from death. So studies shows that neonatal deaths were reduced by 34% if chlorhexidine was first applied within 24 hours of birth. So first 24 hours of birth are very important. So you can find chlorhexidine in every medical store. It is easily available and present by different brand names. So, if there is the delivery of a newborn either at home or in hospital, you must do umbilical cord care by applying the chlorhexidine because everyone cares the newborn. So, how to apply? First, wash your hand immediately after cutting the cord. First, apply this medicine to the tip of cord and then spread to the stump and then around the base of the stump. Apply this medicine once daily for 7 days or until the cord separates. So, for the next time when you are doing shopping for your newborn, you must buy this medicine also. I hope my this video will be informative for you and you will follow my this tip and will spread my message to reduce the mortality of newborns. Thanks for watching. Like the video if you liked it and share it for public awareness.